I think we're good now. It should be recording. Um, okay, recording has started. We're good. So the first thing is just going to be the basics of fetal heart rate monitoring. So my public health clinical, fun fact, is actually at a high-risk OB clinic. So I've been doing a lot of fetal heart monitoring. But our big thing here is just, is baby tolerating labor and is baby getting enough oxygen? So here on the picture, you guys can see there's the contraction sensor, and that's going to be the TOCOS for the external fetal monitor, and that you palpate the fundus, find the top of the fundus, and that's where you're going to put it on. And when you're palpating, like, you can feel it. And then the second one that you see, that is going to be like a Doppler, and it's going to pick up the baby's heart rate. So when you guys have the strip at the top, it's all related to the baby and baby's heart rate, and then at the bottom, it's going to be the contractions. So that's just kind of the basics there. But two big things that are really important to know are baseline and variability. So baseline, it's super important, especially on your quiz, to know that it's not a range, it's a number, and it's the average fetal heart rate that's rounded to the nearest 5 beats per minute for 10 minutes. So if you look at a 10-minute strip, what is the average beats per minute? Normal is going to be 110 to 160, so very different from an adult heart rate. And tachycardia is going to be anything above 160 beats per minute. And again, remember, this is your baseline. So if for that 10 minutes it's above 160, that's considered tachycardia. And then bradycardia is going to be below 110 as your baseline for those 10 minutes. And then variability, I saw it described as how wiggly the fetal heart rate is from the baseline off of Simple Nursing. So if you guys are still needing help too, Simple Nursing has a whole video on this as well that's super helpful. But being wiggly is a good thing. So if it's absent, there's no clear change from the baseline. It's almost kind of like a straight line. If it's minimal, it varies 2 to 5 beats per minute from the baseline. So you might kind of see it squiggle a little bit, but it's still kind of riding the baseline. Moderate is what we want. So that's why it's bolded. If it's moderate, you have a happy baby. And this is going to be 6 to 25 beats from the baseline. So it's wiggly, it's jiggly, all the good things. And then if it's marked, it's greater than 25 beats per minute from the baseline. So this is going to be kind of like a really jagged. You'll see it really jagged on the strip. And this we don't want. So if it's absent or marked, this is going to be our most concerning. We need to have interventions. If it's moderate, baby is perfect, baby is happy. So now we're going to have you guys identify the baseline and variability. So just looking at this, if you guys, and I know it's like hard to see on the screen, so I'm not asking for like a specific baseline, but if you want to put in the chat or unmute your mics if or what the variability is, and if the baseline is normal, bradycardia, or tachycardia. So you guys can throw that in the chat. I'll give you guys a few seconds too. And remember, we're looking at that top strip because that top strip is going to be the baby's heart rate. The bottom is the uterine contractions. And just take a wild guess too. Yeah, so it is a normal baseline. Baseline, I would say around 150, 145, for sure. And then moderate variability. So absolutely right. This is a happy baby. This is something that we want to see. So if you see this, very good. And then here is our second one. So what do you guys think the baseline and variability is for this one? And this is not a trick question. I'm not trying to trick you guys. All right, so for this, the 135 baseline, absolutely. That's what I would say as well. For this, it actually is still a moderate variability. So remember, moderate variability is 5 to 25 beats above the baseline. So we do have times that it jumps up between that 5 and 25. So it's really important to pay attention to your little boxes. If you're not quite sure, because at first glance you could be like, oh, this is minimal, but it is going to be your moderate still. You guys have any questions on that before we move on? Okay, I don't see anyone typing, so we're going to keep going. All right, so this is just going to be a good visual for you guys. I'm definitely a visual learner, so this is really helpful for me. But this you can see absent, you don't really see any wiggle at all. Minimal, very minimal amount of wiggle. It's still just riding that baseline, but you can kind of see it move a little bit. And moderate is going to be your nice, good looking beats, and then that marked is going to be that really jagged all over the place. So refer back to this if you're a visual learner like me. It's super, super helpful. And also refer back to the strips that you guys have on your PowerPoints from class too. Those are really helpful to use to study. All right, so now talking about accelerations. So these are temporary increases in your fetal heart rate, and you want to see greater than 15 beats per minute for greater than 15 seconds. If you're seeing this, we have a happy baby, all things are good, and it means that it's great oxygenation for baby. So this is a very good thing. We want to see this. And this is something that when we're doing our fetal heart rate monitoring in the clinics, this is always something that we have to document and something that you need to see. All right, so now for decelerations. These are dips from your baseline. So if we have early decels, they are excellent. So remember those two E's. They mirror the mother's contractions and they're a sign of progress in labor. So these are a good thing. Our variable decels, these are very concerning. So the two V's, and these are going to be sharp V dips that you'll see in the fetal heart rate monitoring. And this indicates cord compression. So this is not something that we want to see. And then we have our late decels. So these, the late decels, lethal, just L's to remember what it is. Remember that it's not a good thing. And so these are dips after the mother's contractions, and they indicate a decrease in oxygen. So remember, we want to make sure baby is being oxygenated. Baby's not oxygenated, not a good thing.
Some Wonder Woman.
All right. So these are our deceleration interventions. So for early decelerations, just document, continue to check progress, and continue to monitor. But again, these are good things. We want to see them. Variable decels, you're going to reposition. One of the biggest tips that I can give you is if you see reposition as an answer choice, if something is wrong with the fetal heart rate, pick reposition first. You always want to do the least invasive, and the best thing that you can do is reposition and reevaluate. So if reposition is an answer choice, take it. And this can also end up leading to a possible amnio infusion, but probably not something they're going to ask you on the test. Just remember reposition. And then for late decels, this is going to be your flip, float, and flow. I like to say flip fluids and flow, just because you're giving IV fluids, and that makes more sense to me than float. But you're going to reposition, give IV fluids, and then high flow O2, because remember, there's a cutoff of oxygen, so think of it that way. Baby's not getting oxygenated, we're giving oxygen, giving IV fluids, and again, that repositioning. So really remember, reposition. I promise you it is probably going to be an answer choice. All right, so these again, just if you are a visual learner, if they're a little bit hard to see, I will be sending out a PDF of all of these slides so you can like zoom in and see them. But for the first one, you're gonna see those are like those early D cells, and they mirror mom's contractions. So it's just like if you put the paper, folded the paper over, they would mirror each other. And then your next one is going to be, next to that one is going to be the late D cells. So you see the dip after the contraction. And then that last one is going to be your variable D cells. So you can see those like kind of sharp V marks. All right, so I know you guys know veal chop, but it works. So definitely something to remember. And it's just variable decelerations are going to be cord compression, early decelerations, head compression, acceleration. Okay, good thing. Late deceleration, placental insufficiency. So if that helps you remember it, it definitely helped me. So that's there for you guys. And then we have the sinusoidal fetal heart rate. And this is like a repetitive wave-like hills. So if you see this, not a good thing. There's no variability. There's no response to contractions. Baby has a lack of oxygen, and they are going to need to do an emergency C-section. So this is going to be a super big deal. This is not something that we want to see. So just remember, this is not a good fetal heart rate, and it's going to end up leading to an emergency C-section. All right, so now for uterine contractions. There's three things that we want to look at for uterine contractions, and those are going to be frequency, so how often, and you're going to be able to measure this by the time between each contraction. Duration, so how long, and it's going to be the time from the beginning of the contraction to the very end of the contraction, and then the intensity, how strong. So if you're using a toco, you're going to want to palpate to be able to really feel that intensity. And then the visual down here can kind of help you see what the frequency and the durations are. So for the frequency, you can measure from the very beginning of a contraction to the very beginning of the next contraction. That's the way that I like to do it. Some people like to do it from the peak of the contraction to the next peak of the next contraction, whichever way you want to do that. But for me, it just makes more sense going from the very beginning of the contraction to the very beginning of the first contraction to the very beginning of the second one. And then your duration is the very beginning of the contraction to the very end. And that's kind of it for uterine contractions. Those are pretty easy to get. And then the thing that you want to look at for the uterine contractions, that's going to be tachysystole. So this is greater than 5 contractions in 10 minutes. There's no recovery time for the baby if you have all of these contractions happening. So baby goes into fetal distress. Again, not something that we want. So the big thing for this is going to be discontinue Pitocin if they are on that. So that's going to be the big thing that you want to remember for this. All right, so that is your kind of brief overview. I know we kind of went through that really fast, but I really wanted to just give you guys the basics of everything that you guys need for that, and then we'll go into some practice questions. But before we do practice questions, does anybody have any questions or need anything clarified of what we went over? I try to like really bullet point it for you and make it something that's just easy. You can open it up, it's quick to study, and you know exactly like the vital information. I see somebody's typing, so I'll give them a minute. But and like I said, I'll post the PDFs to everything, and when I go in and post it, I'll also post the correct answers to the questions that we're going to be doing as well, so that you guys have them to study off of. All right. I'm not seeing any questions. So if you have questions, feel free to keep typing them in the chat. But we'll go on to the questions that I have for you guys. So on the fetal heart rate monitor, you see early decelerations. What is the cause of this finding? A, the baby's head is pressing against the pelvis or soft tissue. B, it's due to the uteroplacental insufficiency. C, it's caused by cord compression. Or D, it's caused by a prolapsed uterus. And feel free to throw the answers in the chat. Nice. You guys got it. The answer is A. So remember, those early decelerations is just the head pressing against the pelvis. So again, these are good things. All right. So true or false, variable decelerations may appear at random and may be unrelated to the mother's contraction. All right, I see a false. Are there any other guesses? This one is a tricky one. Yeah, so this one is actually true, because remember, variable decelerations have to do with cord compression. So cord compression could be completely unrelated to mom's contractions. So this one was a little tricky, but remember, cord compression for the variable deceleration. So that one is true. All right. So the client is having fetal heart rates of 90 to 100 beats per minute during contractions. What is the first action that the nurse should take? A, reposition the monitor. B, ask the client to ambulate. C, turn the client to her left side. Or D, prepare the client for delivery. B, absolutely right. I told you guys those questions are everywhere. You always reposition the patient. Nice. All right. This is a select all that apply question. I know everybody loves those. A nurse is caring for a client who is in active labor. The cervix is dilated to 5 centimeters and membranes are intact. Based on the external electronic fetal monitor, the nurse notes a fetal heart rate of 115 to 125 beats per minute, with the occasional increase up to 150 beats per minute that lasts 25 seconds. There is no slowing of fetal heart rate from the baseline. The client is exhibiting which of the following? Select all that apply. And your answer choices are moderate variability, fetal heart rate accelerations, fetal heart rate decelerations, normal baseline, or fetal tachycardia. All right, you guys got it. Nice, guys. Yeah. So the correct answer is moderate variability. So A, fetal heart rate accelerations, B, and then D, normal heart rate base or normal fetal heart rate baseline. So we're right in the range that we want to be. We have that variability of 5 to 25 beats per minute. And we also have increases. When it talks about those increases up to 150 beats per minute, those are going to be our accelerations. So you guys are exactly right. All right. Which of the following statements describe variable decelerations? Variable decelerations are uniform. On the fetal tracing, the heart rate will mirror the mother's contractions and represent uteral placental insufficiency. On the fetal tracing, the heart rate will increase after the mother's contraction and return to baseline after the contraction ends, or on the fetal tracing, the heart rate will go up and down and present when the cord is compressed. Yeah, perfect. Perfect. The answer is D. So remember, variable decelerations is cord compression. That is your veal chop. That's where that comes. All right, so that was all the questions that I have for you guys. This I know I'm pretty sure is open book for you guys, so absolutely I'll go ahead and put a PDF of all these slides in there so that you could see them. I know I'm a visual learner, so it's really helpful to see everything in there. And I know it was really quick, but it's a quiz, and I wanted to give you the brief rundown of all the things that you need, and just the key points for you guys to study. So definitely go back through this PowerPoint and use it for your advantage. But if you guys have any other questions, please let me know. I'm going to go ahead and stop the recording though, and then if you guys have any questions, we can answer those.